Well, we're here with another episode of Conversations and Connections. We're the official podcast of the Family Crisis Center of East Texas. I'm Stuart Burson, the prevention coordinator for the agency. And today I have Dr. Sid Roberts with me. Dr. Roberts is here to talk about a new initiative. Well, I don't know how new it really is now. I think we're just kind of now really getting things started. And it is Angelina Thrive. And Dr. Roberts, first of all, thank you for taking some time out to be here with me today.
Well, you're welcome. I appreciate it very much.
Well, I guess, first of all, Angelina Thrive's mission, when you look on the website, Angelina Thrive's mission statement says that it's a nonprofit organization that exists to be a trusted broker for collective impact in Angelina County in areas of health, education, and financial security. If you would, let's break that down about exactly what the purpose of Angelina Thrive is.
Well, that's a great question. And I think in some ways, the organization is still feeling its way along.
Right.
When you look at nonprofit organizations in Angelina County, I mean, there are literally hundreds, actually. And I think one of the problems with the nonprofit status in Angelina County is nobody knows what everybody does.
Okay.
There are a lot of organizations, and even within the nonprofit community, for example, if you got asked, what does the Family Crisis Center do? Or what does Goodwill do? People may have a 30,000 square foot idea, but they don't know what the details are.
Right.
So back to Angelina Thrive. When I first started looking at the health needs of Angelina County a number of years ago, the Robert Wood Johnson Foundation ranks counties according to health, if you will. And Angelina County is surrounded by the lowest ranked counties in the state of Texas as far as health is concerned. And Angelina County is actually low down there as well. And I got to looking at that thinking, why do we rank so low when it comes to health? Mm-hmm. And there are a lot of determinants of health, if you will. They're called social determinants of health. Things like smoking, access to health care, education, poverty, things like that. And so it's not just health care. Health is much more than that. Mm-hmm. And it became apparent that if we were going to try and move the needle of health of Angelina County and eventually surrounding counties, we couldn't just address access to health care or quality of health care. There's so many other issues involved. During that whole process, I met with Elena Marks, who at the time was the CEO of the Episcopal Health Foundation. She had come up to East Texas and had had a little seminar up in Nacogdoches that I attended. And one of the main points of that was just exactly what I said, that it takes more than just addressing health care to talk about health. She introduced me to a gentleman in Waco, Tom Stanton, who at the time was the head of the Rappaport Foundation, and he was one of the co-founders of an organization in Waco called Prosper Waco. And Prosper Waco was designed very much to do the things that we are looking at doing with Angelina Thrive. And back to the health issue, if you think in your mind of a Venn diagram of health, it overlaps with financial security. It overlaps with education.
Yeah.
So you can't address one without addressing the others. So those became kind of our focus, our three legs of our stool, if you will.
Okay.
And as this group got together and started organizing, we realized that Other organizations have done community health needs assessments. CHI does one every 3 years. SFA had come down and done a needs assessment as well. So we didn't want to spin our wheels repeating studies. And as we formed, we came to this actual question of, well, what exists in our community already? Nobody wants to duplicate services. Nobody wants to compete for funding in a community that's already tapped out. And Prosper Waco had contracted with an organization called Thriving Cities Group. It's a national nonprofit. And through their work with Thriving Cities Group, they put together what's called Roundtable.
Okay.
And this is a website that all the nonprofits in the community can be a part of. And it combines census data for our community, granular census data. You can go by zip code, for example. And then it tags those indicators to local nonprofits. So if a nonprofit has interest in education, for example, and you're looking at indicators with education like graduation rates or third grade reading level or things like that, ideally, those indicators will point to local organizations that address those indicators. So we thought, since none of us actually really know what all is going on in our community, this would be a great first project.
Sure.
Now, interestingly, the coalition does a great job of maintaining a list, if you will, of nonprofit organizations. But they publish that, and it's a sheet of paper with a name and a phone number, and that's it. So if you don't know that Goodwill does skill training, job training, for example, you're not going to call Goodwill. This roundtable platform will give Goodwill a place, along with other nonprofits, to have a presence that says, this is Goodwill. This is our mission statement. This is what we do. And here you can link to our website. Here's a phone number. So our goal, at least initially, is let's start the cooperation and the communication among nonprofits that already exist. Let's give all of us a tool for communication and cooperation. One of the things that Prosper Waco found when they established Roundtable was that outside funders started to see what was available in their community and approached them about potential projects in their community. Once they knew that there was an avenue, an opportunity to work in the community, then it helped bring in outside funding as well.
Sure. So I get Thrive, is it mostly geared then to other nonprofits, like fellow nonprofits? Will the general public or the community be able to access this information, or is it mostly for communication between other nonprofits to kind of collaborate on a certain level?
Yes, I certainly hope that nonprofits will point people to the website for additional information. I hope that economic development, for example, would be interested in letting people know that are looking to come to Lufkin what the nonprofit community looks like in Lufkin. And they can point them to this and say, hey, this is how rich this community is in nonprofit work. Rather than providing a list or saying these organizations exist, go and look at this site.
Sure.
So I'm hoping it will be both internal for nonprofits and outward facing as well.
Got you. Okay. And you said a similar program was initiated in the Waco area, correct?
Correct.
How successful has that been?
I think it's been really quite successful. Again, sometimes foundations that want to accomplish work need to know what avenues they can work through.
Sure.
And just as a local example, I had someone approach me wanting for the city to consider a handicap accessible park. And how would they go about looking at that project?
Right.
And I said, well, first of all, you obviously need to go and talk to Parks and Recreation Department. You need to work with the city and see what their parks master plan is, what sort of level of interest there is at the city council level. But let's assume there is interest in moving that project forward. You're going to have to find donors that are interested in supporting that project as well, and working with the city. But rather than you as an individual go and create yet another nonprofit for this one project, maybe this is something that Angelina Thrive can come alongside you and assist you in meeting your goals. And in that way, again, going back to that trusted broker idea, let's not create another nonprofit. Let's see how we can work to accomplish goals within the framework and the system that we have available to us.
Sure. How long has the Angelina Thrive, and I don't know a way to put this, is it live yet? I mean, or can nonprofits look at this? Because I know there was a call for nonprofits to start registering. I think the Family Crisis Center has filled out the online form to do this. So is all that information accessible now to people on the website, or when will it be?
Yes, it is now live. Okay. That's brand new over the last couple of weeks.
Okay.
It has taken a number of months to work with Thriving Cities Group to get the Roundtable website built. So the Angelina Thrive as an organization is just about a year old. Okay. So it just came to being last year, and this is our first project. So the site is live. People can go to angelinathrive.org and look at the site. There's a button at the top to link to Roundtable. We are definitely in the process of recruiting nonprofits to go online. And, you have to, the first step is basically to create a username and password, and then you start filling out information about your organization. And that information comes to me for review and approval. And I think now we probably have, it's less than 10, but 7 or 8
okay, well, that was going to be my next question. How's the response
right now? So it's very good. I've been to the Executive Directors Forum and the coalition group to give the pitch, but we will be approaching nonprofits and asking them to participate. But certainly they can contact me through the website or go on and actually start the sign-up process. If you're on the Roundtable site, in the drop-down menu, there is a log-in or sign-up click that you can go to as well. It should be very user-friendly.
Excellent. All right. Well, is there anything else that we haven't covered that you want to make sure people know about Angelina Thrive? I think this is a great idea, and I'm glad you kind of clarified, because one of my questions was, we do have an interagency coalition, and not to say, well, why do we need Angelina Thrive for? But exactly what is the difference between like what the interagency coalition does and Thrive? I think you...
Yeah, and the Interagency Coalition meetings are a great venue for people to get face-to-face and talk and kind of share what they're doing verbally.
Right.
But this is a way to turn that outward-facing to the community, and not just the community, I think to the broader nonprofit world. I mean, ideally, there are projects that we probably can accomplish that aren't going to be locally funded necessarily, or that may require multiple organizations to be involved in different pieces or different aspects of it.
Sure.
So we're feeling our way along. I'll be very honest about that. We think this is a great place to start and are anxious to see the nonprofit community embrace it and grow it and work together. I like to say so that Angelina can thrive.
Right. Excellent. All right, Dr. Sid Roberts, thank you so much. I appreciate your time and getting over here. I know our facility where we're at may be a little difficult to access, but I appreciate you coming forward today to share this information.
Well, it's my pleasure, and look forward for everyone working together. Thanks.
All right. Thank you. Dr. Sid Roberts, Angelina Thrive, and you go to angelinathrive.org if you're interested, and click on that roundtable link to fill out the information and create an account for your nonprofit. And if you feel like, I always like to close out the podcast, if you feel like you have any need for the Family Crisis Center services, we do have that 24-hour-a-day, 7-day-a-week hotline. That's 1-800-828-7233. And be sure to subscribe to Conversations and Connections. You can do that via Spotify, Apple Podcasts, Google Podcasts, and any podcast service of your choice. Be the voice, if not for you, for someone else.